following podcast is taken from a webinar presented by Dr. Terry Ollivett from the University of Wisconsin School of Veterinary Medicine. To view the full webinar and access the slides referenced during this podcast, visit balchem.com/realscience and scroll down to the webinar presented on May 4th of 2023.
All right, well, thank you. It's great to be with everyone this morning and talk about something that I have become more and more passionate about over the last decade as we've learned more about how we can use this tool using lung ultrasound to monitor cattle health. Particularly right now, the emphasis is in young cow health, but this is a tool that can be used in adult cows as well. And today I'm going to really be talking about, how do we keep these animals breathing easier using the lung ultrasound? And by breathing easy, what I mean is how can we detect disease sooner? And I want to show you, the audience, some different examples of using videos, using farm data to show you what subclinical pneumonia really looks like, how early we can detect it compared to clinical disease, and kind of what it means for you when you walk out into your barn, when you hear a cough or see a sick calf. So hopefully I'll be able to provide some answers for you today and give you some food for thought to think about what you're doing right now to provide oversight of these animals in your operation.
The economics of feeding ReaShure precision release choline. ReaShure is fed during the transition period, and because it's fed for such a short period of time, it costs just $15 per cow, and yet the benefits will continue to generate income throughout the year. Cows fed ReaShure produce 5 pounds more colostrum, which pays for your ReaShure investment on the very first day of lactation. Cows fed ReaShure also produce 5 pounds more milk per day, every day. That means after the first day, every day is payday. Invest in ReaShure during the transition period and recoup your investment on the very first day of lactation. After that, you got it, payday.
I think many of us are familiar with the phrase, the eyes are the window to the soul. This is a Shakespeare phrase from a long time ago. And in my mind, with young calves, young dairy cows particularly, I see the lungs as the window to calf health management. So when things go wrong in the lungs, it tells me that there's something going wrong in their environment. And I don't just mean the ventilation or the facilities, but everything around the life of that young calf, right? I think the lungs are what I call an indicator organ. So when I see respiratory disease in a calf operation or in a calf barn in young stock, it really tells me that there's a management failure happening, right? The lungs and respiratory disease is a symptom of management failure. So I will talk a little bit about the bacteria and the viruses that are involved in respiratory disease, but I tend to look at respiratory disease more holistically as a symptom of management failure. For instance, I'm going to list several things here that when they go wrong, we can see it manifest as pneumonia in the lungs. So if you have failure passage transfer, we tend to see higher rates of pneumonia in those calves. If you have diarrhea in your young calves, we tend to see pneumonia a week or so later. If you have septic calves, we end up seeing it in the lungs. If you have poor nutrition, a dirty environment, cold stress, even heat stress, we can see it manifest as pneumonia in the lungs. And more often than not, it manifests as subclinical pneumonia, which means the lungs are abnormal, but the calf externally looks completely normal. And because of this sort of mantra, I suppose I would say, I've developed something called the wean clean philosophy, which means if we are managing calves properly, to the best, to what they need, they are going to get to and through the weaning period with clean lungs, right? So if we get calves to 60 days, 70 days, 80 days, however old they are when you're weaning them, and they have nice clean lungs at that point, it tells me that things are working in your program, right? So just keep that tucked in the back of your mind. In the next few slides, I'm going to talk a bit about the airway defense mechanisms, get into a little bit about the organisms that are involved, and really focus in on coughing calves, because, for a long time, coughing is kind of that hallmark symptom that a calf has respiratory disease. Of course, they can have a fever, they can be breathing heavy, they can be depressed, they might have droopy ears or a snotty nose. But I think cough is that one thing that we always associate with, oh, probably need to treat her, she probably has pneumonia. And I'm going to get into a little bit of what the lungs look like in those coughing calves. So just to start with those airway defense mechanisms, thinking about how that calf is built in order to protect its lungs from disease. So in this slide, at the top part where it says particle entrapment, you can think of this as starting at the nose, at the nares, so the nostrils and the nasal passages. And the arrow goes all the way down deep into the lungs. And so all the way along that path between the opening of their nose and their nostrils down into their lungs, there's different mechanisms in place. You have little hairs in your nose. The calves have little hairs in their nose that are going to help trap particles to prevent them from going down in the lower airway. You've got what we call the mucociliary apparatus and the cough mechanism. This is a little function, a little escalator basically on the surface of the respiratory tract that kind of constantly moves all the bad things that get down in the lower airway up, and then the calf can cough them out. Down in the lungs, there are products called innate defense proteins. So there's proteins that can help. Some of them have antibacterial properties. You've got cells down there, these alveolar macrophages. You've got neutrophils that can come in when an invader or pathogen has gotten down there, and the animal can then, create that immune response to get on top of any infection or inflammation that's going on down in the lower airway. So there's pathways all the way down the respiratory tract to try to help prevent bacteria and viruses from getting down there and to deal with them once they do get down there. And so what I'm looking at here is just kind of the side view of a calf. So I'm going to talk about different parts of the respiratory tract. I just want to show you what I'm specifically talking about, because when we talk about where pathogens are, where bacteria are, it becomes helpful to kind of think and visualize exactly where in the calf we're talking about. Because you'll often hear me, I'm going to talk about deep nasopharyngeal swabs. We'll talk about trach washes a little bit. But when we're taking deep nasopharyngeal swabs, if you've done this or your veterinarian has done this, or maybe if you're not familiar with it, that's a technique where we take a long swab and we're going to go through the nasal passage, through the nostril, and we're going to sample the back of the throat here. So deep in the back of the throat, just before the opening to the trachea. Number 2 here is that trachea. And if we go down that trachea or the windpipe, that's heading down into the lungs. And so there's pretty good work that suggests bacteria and viruses that live back here in the nasopharynx are pretty similar to what we would find down in the lungs if we were sampling the lungs, okay? That's important because you have to think about, if you're a veterinarian or if you're a veterinarian on this call and you're taking respiratory samples, if we're taking upper airway samples, we want to make sure that we sample an area that's going to be most representative of what's going on in the lungs, where the primary disease is happening. And that nasopharynx is a very good place to do that. The nasal passages itself, we can take samples from there, but the bacteria, the organisms we isolate from the nasal passages, it does not correlate nearly as well with what we would find in the lungs. So it's not as reliable an indicator if we're trying to determine a pathogen profile for what's causing respiratory disease in your calves and your farm. So what I did was I went through and looked at some research, and again, trying to focus in on what does a coughing calf really mean, right? And there's a paper here from a few years ago now. It's from 2010, where they actually looked at the cough sound description in relation to respiratory disease in calves. Again, remember with lung ultrasound, the whole premise of this talk is that we're thinking about how can we diagnose disease sooner? Okay, what does it mean when we see clinical signs, right? Those visible signs of disease. So we're going to focus on coughing here. And in this study, they had 12 weaned dairy calves that had clinical respiratory disease, which means they were visibly affected. So they had some clinical sign associated with respiratory disease. And in particular, they all had a positive cough. Okay, so you know these calves, you walk in and they cough as soon as they see you. And what they found in this study was that these calves were very highly likely to have Pasteurella multocida, most commonly, and more common than the viruses that we can see here, BRSV, BHV, PI3, BVD. hopefully if you vaccinate for respiratory disease, these 4 viruses look very familiar to you because it's going to be in most of your modified live vaccines that you're using in these calves, okay? But more often than the viruses, these calves had Pasteurella multocida. It's going to be the most common bacteria that we see in young calves with respiratory disease. Okay, so take home that I want to tell you here is that those calves that have a cough all have some respiratory pathogen associated in their respiratory system. Okay, so if you hear a cough, it's hard to say fast. If you hear a calf coughing, it is highly likely that you will find a respiratory pathogen associated with that. Okay. But then the next thing I wanted to know was, well, what do those calves, what do their lungs look like? Because just because a calf has a respiratory pathogen associated in its respiratory system, does that mean that they actually have pneumonia? All right. And so this is a study that was done in, just last year here in 2022, where they looked at the differences in the association of cough, other clinical signs, and they compared it to ultrasound lung consolidation in a mixture of calves, so dairy calves, veal calves, and beef calves. So this is a study out of Europe, and what they found when they looked at clinical disease versus lung ultrasound was that cough was the best indicator, right? So in that last study, said if calves are coughing, weaned calves have a cough, they've got pathogens there, more bacterial than viruses, but they've got pathogens. This study says if they cough, they are highly likely to have pneumonia, okay? But it wasn't extremely sensitive, okay? So cough out of nasal discharge, ocular discharge, ear position, cough was the best clinical indicator to say that they had pneumonia on the ultrasound, but only 37%. So out of 100 calves that had pneumonia on the ultrasound, cough only found 37 of them. Okay, so still not a very good test for finding calves that truly have pneumonia. Okay, all right, so that's what that's saying over here on the left-hand side in the red. Coughing calves have ultrasonographic lung consolidation, which means pneumonia, but most consolidated calves don't cough, right? It's not a good early warning tool. And what I want to show you is some real life lung ultrasound data from a herd here in Wisconsin that does routine lung ultrasound scores, right? And I'll get into the details a little bit more about what these lung scores mean. But for right now, I just want you to know that a score 0 means the lungs are completely normal. A score 1 means they're very mild changes. They might be a little bit associated with viral disease, but typically quite mild changes. Score 2 through 5 means that calf has bacterial pneumonia. A 2 is very mild bacterial pneumonia, and 5 is very severe bacterial pneumonia. Okay, you can see the number of animals that we scored and the percentage of animals that had each of those lung scores. So most of the calves out of these over 2,000 animals were in that score 2 or score 3 category if they weren't normal. And what I'm also showing you is the number of calves that were coughing in each of those categories and the percent of calves in that category that had a cough, right? And what we found here is that, yes, if they had a cough, they were 2.1 times as likely to have pneumonia, okay? But when we looked at the whole picture, and again, looked at the sensitivity, so of all of the calves, how sensitive was cough in identifying them with pneumonia, the sensitivity was only 9.7%, so about 10%. So in our real life, commercial herd, routine lung ultrasound scanning that we're doing, if a calf was coughing, it's highly likely that it had pneumonia, twice as likely to have pneumonia than a calf that wasn't coughing. But only 10% of the calves with pneumonia were coughing. Okay, so somewhat similar to that last study, where if they cough, they're likely to have pneumonia, but if they don't cough, it really tells us nothing. Okay, and again, it's about that subclinical pneumonia. Subclinical means they don't have any visible signs of disease. And so it should make perfect sense that there are a lot of calves out here with pneumonia that don't cough. Okay. So I'm going to show you some videos here to kind of highlight that difference between clinical and subclinical pneumonia. So we've got 3 calves here, and I think about this as a bit of an iceberg effect. So, we talk about iceberg type diseases. A lot of times we have mastitis, right? Subclinical mastitis. You have a lot more subclinical mastitis than you do clinical mastitis. Johne's disease. You have a lot more subclinical Johne's disease than you do a lot more subclinical Johne's disease than you do clinical ketosis. There's a lot more subclinical ketosis than you have clinical ketosis. And now that we have ultrasound available to us, we can now say the same thing for pneumonia. We have much more subclinical BRD, subclinical pneumonia, that iceberg underneath the water, compared to clinical BRD. Okay, now we have a tool that we can actually use to find it, because we're not going to rely on what the calf looks like, but instead we're going to rely on what the lungs are telling us. And so these 3 calves, this calf on top, this is a 5-week-old calf. This is pretty textbook respiratory disease, right? We've got a calf, if you were to feel its top line is very thin. You can see it's when it stands to the side, it's very, has its head and neck stretched out, its ears are droopy, it's breathing labored, it does not want to move. This calf is very sick, and there's usually no trouble in saying, okay, this calf probably has pneumonia. Well, then we have this calf in the middle. You'll notice, hopefully the video is playing at the same time as mine, that I just induced a cough in this calf. This is a 10-week-old calf. You see she's got droopy ears. I'm inducing a cough in here. She coughs multiple times. So based on our University of Wisconsin calf health score, the clinical respiratory score, she is positive for clinical respiratory disease. She has multiple inducible coughs, and she has bilateral ears. She has both ears are droopy. Okay, so she has visible signs of respiratory disease. The reason I'm looking at this calf on that day at my visit to the farm is because she's so small. So this calf actually weighs 105 pounds, and I told you she was 10 weeks old. She should be just about as big as this heifer here in the back. At 10 weeks old, if they're growing according to our gold standards, where we want them to double their birth weight by 8 weeks of age, this calf should probably weigh, at 10 weeks old, she should probably weigh around 210 pounds. So she is severely stunted. Okay? She has clinical respiratory disease today. Okay, and so one might think that, well, she probably is a chronic pneumonia, and that's why she's so small. Well, the calf on the bottom is a 3-week-old calf, and once the video catches up, you can see I accidentally hit the slow-mo button for extra dramatic effect here. But this calf is sucking on my finger, chasing me around her pen, happy, 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 no cough, no nasal discharge, no droopy ears, no fever, just happy as a clam, all right? Well, I had the opportunity to, the first calf, the second calf needed to be euthanized, right? These were chronic, poor doing animals. So they were both euthanized, and I necropsied those animals. So you can see what their lungs look over on the right-hand side of the screen. This bottom calf here, although happy looking, I knew based on ultrasound that this calf had severe pneumonia, or I was highly suspicious of it. This was very early on in our research on using lung ultrasound. And so because this calf was a research calf, we did euthanize this calf and do a necropsy so that we could confirm that what we saw in the ultrasound was indeed pneumonia. Okay, so what I want you to think about is, if you had to pick which one of these 3 calves had the worst lungs, most of you would probably say 1 or calf 2, calf 1 or calf 2. Most people, unless they know it's a trick question, would never say that calf 3 has the worst lungs. And when we look over here on the right-hand side and we see the lungs of each of these calves taken from the same day that video was taken, I'll orient you just so you really know what you're looking at here. We're looking at the right lung where the calf is laying on their left side. So the head would be over here to the right of the screen or the right of the image. The tail would be to the left of the image. The top of the picture would be like the spine, and then the bottom of the image is the sternum. And so we've lifted the rib cage up and we're looking down into that right lung, where we have one lung lobe that's completely consolidated. It's red and firm right here in front of the heart, which is located right here. We have a normal lung lobe right here just behind the heart. Then we have a second lung lobe that's completely consolidated here behind the heart, and then more normal lung up here towards the back. So for this first calf with 2 lung lobes completely consolidated like that, because each of these lung lobes is roughly about 6% of the mass of the whole lung, we can say that there's 12% of the lung affected in this first calf. Okay, hopefully that makes sense to you. Then we go to this middle calf who looks like she's got chronic stunting pneumonia. And we look at her lungs and we only see a few small, what I would call lobular lesions. So maybe 1 or 2% of the lung is affected, right? I call the first calf has lobar pneumonia where the whole lobe is affected. Okay? Second calf has a lobular pneumonia, very mild pneumonia, only 1 or 2% of the lung affected. And then we come to that third calf. And again, we have one lung lobe completely affected and a second lung lobe completely affected. So again, this calf is probably in that 12% lung affected. So the first calf and the third calf have similar amounts of lung affected with pneumonia and look completely different clinically. So that's the take home. This third calf down here on the bottom, this is what subclinical pneumonia looks like, right? You can't pick them out. Right? They are prey species. It's part of my rationale for why calves do this. They don't want to tell you they're sick, right? Way back when they were trying to prevent themselves from being chased down by some wild predator, they didn't want to give any indication that they were sick, okay? I think that's probably why we see subclinical disease in these animals, because they are trying to hide the fact that they're not so fit, right? And we can't shame farm employees, we can't shame veterinarians for not picking up on these clinically because they just don't have clinical signs to tell you that they're sick, but yet they can have extremely abnormal lungs. All right. When I talk about the scoring system that I use, I referred to it earlier as score 0 through score 5, and I'll just show you what the lungs look like for each of these scores. So again, we're looking at the right lung oriented just like I showed you in that previous slide, where for each image, the head would be to the right and the tail would be to the left. The spine is up at the top of the picture and then the sternum is down here. So we're looking into that right lung. A score 0 is going to be nice, spongy, pale pink lung. A score 2 is going to be that lung with very small patches of lobular lesion. This is a score 2 in the upper right-hand picture, which is just a slightly larger score 2. So there is quite a bit of variability in a score 2 calf. You can have a few centimeters of disease, or you could have 10, 20, 30, or 40 centimeters of disease, okay, these red firm areas. A score 3 means that that calf has one lobe that's completely consolidated. A score 4 means there's 2 lobes consolidated. And score 5 means that there's at least 3 lobes completely consolidated, right? And when it comes to pneumonia in these young calves, these lobes, this pattern of disease is extremely repeatable, extremely similar from calf to calf to calf when it comes to bacterial pneumonia. Bacterial pneumonia likes to start in this front lobe first in most calves, and then we see it in this lobe here, the right middle lobe, and then the lobe in between, we'll see it as well. So if there's one place that we're going to look to find pneumonia, it's going to be up here in the front of the heart, where the most common place to see pneumonia. Now, you'll notice there's not an ultrasound score 1 picture in here, and that's because in young dairy calves, we just don't see very many ultrasound score 1 lesions. That ultrasound score 1 is typically, it's going to be viral in nature, or it might be secondary to septicemia. It's a heavy, wet, rubbery lung. We call that interstitial pneumonia versus bronchopneumonia that we're seeing here. And in young dairy calves, we just don't see very much of that. Maybe 1 to 2 to 3% of calves will have that kind of a pneumonia. If we do see that in a dairy operation or in dairy calves, then we really got to start thinking about other diseases that mimic respiratory disease, like salmonellosis, septicemia. And again, yes, viral disease can do it. If you happen to be raising bull calves that aren't vaccinated because they're going to go to a stud, then we might see a little more viral disease in those young animals. But for the most part, your dairy heifers that we're raising that are pretty well vaccinated, we don't tend to see a lot of that ultrasound score 1 disease. And our work has shown that the sensitivity of lung ultrasound to find these lung lesions in animals without subclinical disease, or even if they do have clinical signs, is going to be greater than 88%. So that means, if the animal looks sick, or even if the animal doesn't look sick, we're going to find at least 88 out of 100 of them with our lung ultrasound. Okay, so remember what we saw back a few slides ago about how sensitive the cough was. We're much more sensitive or much more capable of finding calves with pneumonia when we use the lung ultrasound. I think the sensitivity was about 35% with cough. Clinical signs were probably up around 60 to 65% sensitivity. So if a calf has multiple clinical signs, we can find 50, 60, 65 out of 100 of them. Okay, so hopefully you're getting a picture that the ultrasound is a much more sensitive tool. If you're using, I'll just go back one slide to further emphasize this point of how sensitive lung ultrasound is. You know, we as veterinarians like to wear a stethoscope. And so how good is a stethoscope at finding these lesions? Well, the sensitivity of stethoscope is only about 6 to 10%. Okay, so using a stethoscope, we only find 6 to 10 calves out of 100 that have these lung lesions. Okay, so not very sensitive at all. So what am I looking at on the ultrasound? So here on the left, hopefully the video is playing for you. Just going to show you what it looks like to ultrasound a young dairy calf. So this is a one-man job. We restrain, we do the scan, we enter the data into an app that we have on our phone. This is a student who, I think this is his second day learning how to scan. By his third day, he's going to be even faster. I expect to be able to scan about 30 to 40 calves an hour without a helper. With a helper, you can be up in the 70 to 80 calves an hour. This is a tool that's meant to be fast and meant to be done on large groups of calves in a short period of time. Okay, so we just get that calf in the corner, put some alcohol on the side of its chest, and then we use our ultrasound, the same ultrasound that your veterinarian uses to diagnose pregnancy in a cow. So using that rectal probe. And what we can see are the images shown here to the right. I'm going to pause this one on the right. And actually, I'll go back here. So that if we look at the loop on the right, that's the normal lung. And I'm showing you this is one lung lobe. Here's a second lung lobe. The same. Third lung lobe, fourth lung lobe, fifth lung lobe, back to the front. This is the whole scan, what you've just watched. It takes about 15 seconds to do a scan from the front to the back of the calf. And what I want you to appreciate on this video here, if I get to the right loop, is there are a lot of horizontal white lines. This bright white line is the surface of the lung. And then when we see horizontal white lines underneath it, that tells us that lung is air-filled and that lung is normal. And that's going to be compared to the lung onto the left. So I'm going to get these in the anatomical correct location. Okay. So these two images that you're looking at here are anatomically in the same spot on two different calves. So we're looking at the lobe right in front of the heart. I see a vessel right here, just the same vessel over here that tells me I'm looking at the cranial lung lobe. And in the calf on the right, I see horizontal white lines. In the calf on the left that has bronchopneumonia or bacterial pneumonia, I now see the architecture of the lung. It's this gray kind of speckled appearance. I can see a blood vessel in the middle of the lobe that's pulsating and when the clip is live. And so I'll let this go, and you can see here's consolidation. There's some normal lung. Here's consolidated lung, normal lung, consolidated lung, normal lung, consolidated lung, and then a big lobe of consolidation. So this calf I just showed you in that 10-second clip has 3 lung lobes that are completely consolidated, so it's a score 5. Okay, so again, just so you can get a visualization of what the difference between abnormal and normal is between these two calves. Now, normal calves do have this structure here. This is the liver. So this is why ultrasounding takes some training, because liver looks a lot like consolidated lung. All right, so we need to make sure we don't make that mistake. All right. So that calf that I just showed you, that was an ultrasound score 5. Here's the abnormal lung, more abnormal lung, and more abnormal lung. So what I just showed you was this lung lobe, the right middle lobe, the 5th rib space. I showed you the 4th rib space, the 3rd rib space, the 2nd rib space, and the 1st rib space. It's very systematic when we do a scan. I can tell you exactly what lobe is affected and how severely it's affected with the technique of ultrasounding that we do. That's why it's such a good indicator for pneumonia, okay? All right. So I showed you a little bit of what the ultrasound looks like, the sensitivity of it. We're going to talk here in a little bit about treatments and some more information. But I did want to point out here that because we're detecting disease after it's already happened. And a lot of folks would say, well, we need to be preventing it. It's why, we need to make sure that it doesn't happen. And that's absolutely true. So even though I'm going to focus on detection of disease here, prevention, everything you hear about maternity management, pathogen transfer, hygiene, nutrition is absolutely critical. Okay. And we're going to get into that towards the end of this talk. But because depending on the farm, 50 to 80% of cases can be subclinical for 1 to 2 weeks before we see them. All right. So we may not even understand the full extent of the problem if we're not looking for it. Okay. If it takes us 1 to 2 weeks to identify pneumonia in a calf because we're waiting for them to look sick, we're already 1 to 2 weeks behind getting them treated. We're already 1 to 2 weeks behind getting a good response to treatment because they're already becoming chronic by the time we see them. Okay. Failure to cure and relapse of those subclinicals to become clinical, or relapse of the clinical cases after treatment, can happen right underneath our nose because we're so late to be treating them when we're working just off clinical signs. All right. So the lung ultrasound, we can use that to see what you as veterinarians, you as producers might be missing, right, in your system. Remember I said the lungs are an indicator of management failure. If we start looking at the lungs, you will get a better handle on what is going right in your operation and what is going wrong. Now, I put this little caveat up here about salmonella. Now, when I say 50 to 80% of calves are subclinical for a week or two before we see them, that's with typical Pasteurella pneumonia, the bacterial pneumonias, Mannheimia, Mycoplasma. Salmonella, if you're dealing with Salmonella septicemia, Salmonella Dublin, Salmonella Newport typhimurium in young calves, these calves can really look sick. They look visibly ill. They look like they have respiratory disease. They're droopy. They're breathing heavy. They have a fever. They might be coughing. Oftentimes, those Salmonella calves, their lungs don't look that bad. Okay, so that changes a little bit of the relationship. There are operations that do have a bigger Salmonella issue than they do Pasteurella, but the ultrasound helps you and your veterinarian sort that out so you can manage it differently. All right. And when we are able to identify who is affected with disease more accurately, we can do something about it, right? So because I did a PhD in epidemiology, they told me I have to put some epidemiological equation on the screen at some point during my talk. So you guys are my witnesses that here is my epi snippet of the day. What this equation says is that prevalence, so that's the amount of animals with existing disease, is roughly equivalent to the incidence, or how fast they get disease, times the duration of disease. Okay, let that sink in a little bit. How many calves currently have disease is related to how fast disease occurs and how long a calf has disease. So when we focus on prevention, we're going to reduce the speed at which disease occurs. So we're going to cut incidence, which is then going to drop prevalence. But if we get calves identified early, get them treated properly, we're going to, in theory, cut the duration of disease. Right? So if we can cut the duration of disease, that's also going to decrease prevalence. So both prevention and proper treatment are going to be associated with the level of overall disease that you have on the farm or in your operation, right? Effective treatment that reduces the duration of disease supports antimicrobial stewardship as well, right? We have more and more pressure to use antibiotics properly, and this is one way that we can ensure that we're doing that. All right. So to put this in practical terms, what does that mean for you? Think about in your own herd. This is just a simple example to put some numbers to it. So a lot of times calves, when we start looking with the ultrasound, calves will be developing pneumonia by week 3 of age, so between 14 and 21 days of age. And let's say for this operation, you get 5 new cases of BRD, of pneumonia per week, right? So 5 cases, 5 cases, 5 cases, all the way up to weaning at week 8. So the middle row, this is meant to show you a herd that has a good cure rate, meaning that 80% of their calves respond to treatment after the first time they're treated. So let's say we get all of these calves treated and 80% of them respond. So that means for the 5 new cases, 4 of them respond to treatment each week. So by the time we get to weaning, there's going to be our 5 new cases, but because there's 1 chronic left over from each week, we've got 5 chronics. Okay? So 10 cases. For herds that have bad cure rates, because they don't detect disease soon enough, let's say 40%, they're only going to cure 2 calves per week, which means that by the end of the weaning period, or by week 8, they're going to have 15 chronics, all right, versus 5 chronics for that herd that has good treatment response. So I just want to use this to visually show you that if you get good treatment response at weaning, you should have more calves weaning with clean lungs. Again, which is our goal. If we can get them to wean with clean lungs, they are less likely to flare up after you wean them. Weaning is that stressful period where everything changes, right? Their diet changes, their facility changes, their friends change. They go from individual housing to group housing or small group housing to large group housing. A lot of stress happens. And so if they have subclinical pneumonia, or anything brewing at that time, we add that stress to them and then they flare up and become clinical afterwards. So by getting them to that time period, to that transition period with cleaner lungs, we should have less problems in the post-weaning period. And it helps again with this antimicrobial stewardship, right? If we're going to treat calves, we better hope that we're actually fixing the problem in their lungs with our antibiotics. Otherwise, it's a lot of drug to use, it's a lot of labor to get them treated, and it's a lot of pressure from an antimicrobial standpoint when it comes to antibiotic resistance. All right. So how do you know if you have some evidence of treatment failure in your operation? So some things that I think about, if you're treating a lot of calves multiple times, right? I don't know what the exact number is, but most literature you would see would probably say that most, like on average, 25% or more get retreated. That's based on clinical disease. To me, we got to figure out what that number is exactly, but if you got to figure out what it is for you in your operation. But if you feel like you're treating too many calves for clinical disease, if you've got poor growth, if you have mortality due to respiratory disease, mortality, when it comes to respiratory disease, most calves don't die immediately from pneumonia, right? So keep in mind, it may be delayed weeks to months, all right, because it really takes chronic disease to kill a calf. So if you're getting deaths in your 2, 3, or 4 month old calves, you may have to back up and look at your pre-weaning age calves to figure out that it's actually respiratory disease starting earlier. That's causing death later on. High prevalence of subclinical pneumonia at weaning. So if they're getting treated but they're not responding and they're not weaning clean, or if you don't have good resolution with 7 to 10 days after treatment of the first case of disease, right? So when I see these things, suggests to me that we have some evidence of treatment failures. In addition, if you have a positive bacterial culture from lung tissue, so you do a necropsy following treatment, that's another indicator of treatment failure. All right, I gotta keep track of my time here, guys, because I could keep you all day if I had that opportunity. So let's talk a little bit more about respiratory disease and antibiotic therapy. So in general, this is just my little schematic to show you how I think about what we're doing when we treat these calves, right? So this calf in the upper left, big snotty nose, have clinical respiratory disease. We can see the pneumonia in this left lung here, this red firm tissue in multiple lobes. And there's going to be bacteria down in that lung lobe that is causing the recruitment of white blood cells, and which results in this consolidation or this red firm lung tissue. Right. So that bacteria, the reason we're giving an antibiotic, right, the therapeutic, is because we want to kill the bacteria that's down in the lung. And if we do that, and if we are successful in killing the bacteria down in the lung, or at least getting it to a level where then the body can take over and finish doing the job the rest of the way, the neutrophils or the white blood cells that are causing this consolidation, those will eventually go away. The lung can become re-aerated and become normal looking again, right? So if we are doing things right, this is what we should see. So this is proper treatment response. Right? So on the ultrasound, what this calf in the upper middle picture would look like is just a big consolidated lung lobe. And then once that calf has responded to its treatment, we should be able to expect to see normal lung on the ultrasound. Now, what we found over the last several years is that's just not always the case. So this is a challenge study where we infected calves with Pasteurella multocida, one of the most common bacteria to cause pneumonia. And we did this because we wanted to look at the effect of treatment. And so we had 17 calves that were given ampicillin or Polyflex. This was a BI-sponsored study for full transparency. And we had 11 calves that were treated with saline. And I know it's small, but you can see in here on the x-axis of each of these figures is just time relative to challenge, okay? And on the y-axis for the top figure, it says ultrasound score 3+. That's the percent of calves that had lobar pneumonia. And I've just shown you images over here of what an ultrasound score 3 or higher calf can look like. So pretty significant pneumonia. And so here, the dark gray calves are our saline-treated calves. The light gray bars are the antibiotic-treated calves. Before challenge, so -1 day, then the calves were challenged. There's no pneumonia in those calves. And then we take samples, or we take our ultrasound measurements 2 hours, 6 hours, 12 hours, and then once a day for 14 days after that challenge. And what we can see is the saline-treated calves and the antibiotic-treated calves, they both develop pneumonia. Can be as early as 6 hours, but by 12, 24, 36 hours, we're seeing a large proportion of calves with lobar pneumonia. Okay, roughly 70% of those calves had severe pneumonia at that point. But then we see the proportion of calves with lobar pneumonia drops precipitously between day 2 and day 5 and day 6 in those antibiotic-treated calves. Now, these calves would have been treated right around the 12 to 24-hour time point, their first time of treatment. They would have gotten treated once a day for 3 days. So by day, by day 4, everyone probably had their antibiotic at that point. But we can see the proportion of calves with severe pneumonia is going down, and then it stays low. So there only 1 out of 17 antibiotic-treated calves had severe pneumonia at this point, 6, 7, 8 days later. Where you can see during that same time period, the saline-treated calves really didn't have much of a diminishment of their lobar pneumonia, stayed pretty consistent throughout the study. And so when we first saw this looks great for ampicillin. This looks like, hey, ampicillin is doing a good job. We're getting a significant improvement in the percentage of calves with severe pneumonia in the first few days of treatment. Okay? But what we saw here, because we continued to monitor these calves with ultrasound, is that around day 9, we started to see an uptick again. So that by day 14, we actually could not tell a difference between treatment groups and the percent of calves that had lobar pneumonia. All right, so good early impact of the antibiotic, but we had a relapse here, okay? So and when you look down in the bottom figure, this is a percentage of calves that had clinical disease. A couple things I want you to take away from this is that there was not nearly as much clinical disease as there was pneumonia. You can see the bars are much shorter here on the clinical disease figure compared to the pneumonia figure. And the response is very variable, right? It's hard to see any pattern between one group looking better than the other. Sometimes the saline calves were higher. Sometimes the antibiotic calves were higher. So if we had only done clinical picture for this study, we would not have been able to see any pattern of pneumonia. Whereby using the ultrasound, we could see the progression of disease, the onset, we could see the resolution of disease, and then we can see the relapse of disease. That is the power of using ultrasound, that you can, with detail, measure the changes in the lung in response to an intervention like this. Okay. Again, these are what some of those lungs look like at the end of that study. So significant pneumonia despite treatment. And when we looked at cultures of those lungs on day 14, the percentage of calves that had culturable, so live Pasteurella multocida in them, was not significantly different than the calves that were not treated. So we gave antibiotic, but we did not result in improved bacterial standpoint in the lungs, okay? This is PCR in the same samples. Again, similar. We see similar amounts of PCR-positive calves, whether they were treated with an antibiotic or not, okay? We repeated this study several times, or repeated this challenge model several times. And you don't need to know the difference between the blue and the yellow bars. But what you can see here is, again, we bumped the dosing up. We went to the high end of the dose, the long end of the duration, but we still saw a relapse in these calves. And then it wasn't until we went to twice a day, which is off label, which you have to talk to your veterinarian about doing, did we see a relapse of disease not occur. So my take-home point of these slides and this information is that not only does subclinical disease exist, all right, treatment failure exists, but we can't always see when it's happening because the calves are subclinical the whole time. Okay, so we can get some response and then we can get some relapse without knowing it's happening. If we use the ultrasound, we can figure out what treatment protocol works best for our calves. Okay, we have objective evidence to say we need to do this treatment protocol, okay, instead of just guessing. When the companies that made the antibiotics that we have available to us were studying them and we're figuring out the dosing protocols, ultrasound wasn't a thing back then. Using lung ultrasound, it was all based on clinical signs. It was based on the presence of a high fever, or the presence of difficulty breathing, or depression, right? So the dosing strategies that are on the labels for these drugs aren't intended or don't necessarily focus on treating infection at the lung level. So that's why we need to use the ultrasound now on your farms, on your operations, to really figure out is what we're doing actually working, right? This is a field study where we really showed the same thing. These calves were scanned twice a week, every week until about 52 days of age. When they had their first bout of respiratory disease, a little more than half of them were clinical, a little less than half of them were subclinical. By the time they got to weaning, only 15% were clinical now, but we had 65% of the calves that were still subclinical, despite being treated. And to make this picture even worse, so all these calves got treated. 80% of these calves got treated twice. 65% of these calves got treated 3 times. Right? So they went Draxin, Baytril, Nuflor. Okay, so good drugs. I'm not throwing any drugs under the bus here, but we could document relapse or reoccurrence or just continuation of a case of pneumonia, even though now it's gone subclinical when we use that ultrasound, right? And why do we care about that? When calves have subclinical disease at the weaning period, more likely to become clinical in the post-weaning period. And this is a lot of disease to still have present when a calf has been treated 3 times already, right? So 3 courses of antibiotics, 80% of the calves still have pneumonia. Okay, so you got to figure out, is this happening on my farm, right? If we're just going based off the clinical signs, we still have a lot of false security that things are doing okay, right? And again, knowing whether or not these calves wean clean is important. Just going to go through some slides here to show you in a real dairy what their treatment looks like when we have started weekly scanning. And what I want to show you here is just how volatile lung lesions are, right? From week to week to week to week. Okay, here's pneumonia treatments by month. Again, up and down, up and down. Initial distribution of age at first treatment, that is, this was going to be prior to initiating lung ultrasound into their program. So you can see that calves were getting treated around a month of age. When we implemented lung ultrasound on a weekly basis, we could see that now calves are getting treated by about 10 to 20 days of age. All right, so using that lung ultrasound in that commercial setting, scanning the high-risk calves every week, we're able to bring the treatment age down from, instead of 35 days, we brought it down to 20 days. And calves are growing better. They are less likely to get pneumonia in the post-weaning period. We're using a lot less drug because we're treating small calves, all right? So I think I am beginning to run out of time. I just want to quickly touch on something here. And I know this is about respiratory disease and using lung ultrasound. But when it comes to raising these calves, the impact that the gut has on the lungs, I think, is astronomical on most dairy farms. So I think in general, as an industry, we are far too comfortable with abnormal manure in these 7 to 14 day old calves, right? Rota, corona, crypto, salmonella. We say every farm has them. Probably, but not every calf should have it, and not every calf should have abnormal manure. Any abnormal manure, and the calf can be bouncing around its pen, but any abnormal manure, these calves are more likely to have abnormal lungs within the next couple of weeks. So it's really important. Make sure you understand what your calves look like from a manure consistency standpoint. When I go to a farm to work up a pneumonia issue, I often end up working up a GI problem, all right? Because it goes undetected in so many cases, and it has such a strong relationship with the onset of pneumonia that if I can just fix calves so they don't have abnormal manure, I usually don't have to do anything, and the pneumonia takes care of itself. Passive transfer is the same way. Make sure you're adhering to the new standards for passive transfer, raising the bar, getting 70% of your calves above 5.7, 40% or more of your calves above 6.1. You will see an improvement in your lung diseases, in your lung lesions. And we're going to get there by making sure calves get 4 liters of colostrum in the first couple hours, and then by tube, and a second meal by nipple bottle at about 12 hours. All right. Keeping that environment clean is extremely important. I don't have time to finish going through all of these slides, but from the first point where that calf comes into the world, whatever it comes across on the way to the calf barn, wherever it lives, we need to make sure that the environment and feeding equipment are extremely clean. I put this up here because I think this is an extremely good resource for producers. This is from Dr. Jennifer Van Ost. We collaborated with Dr. Sockett to create some fact sheets that she has available on her website under animal welfare at CALS at Wisconsin. 6 or 7 different fact sheets. The hygiene one goes through in detail how we think calves' environment and calf feeding equipment should be clean. This is really important. We can use luminometer to make sure that it's working effectively. And so, sorry to kind of rush here at the end, but we do need to make sure that in order to keep them breathing easy, right, we have to, of course, use the ultrasound to make sure that we're detecting disease, but use that ultrasound to know when problems are starting, know when management failure is happening. And where does management failure happen? It can happen before birth, right? It can happen when we get too many animals calving in at once. We don't have enough space in maternity. The bedding gets dirty. The calves get dirty when they're born into that. At birth, right? They could be born into that dirty environment. We cannot meet our passive transfer goals. We can have them cold stressed. And then after birth, making sure that they're growing at least a pound a day in that first week, regardless of weather. We need to make sure we're feeding enough volume, feeding enough pounds, making sure that we're doing it consistently, the same meal, the same way every day. Deep straw bedding, jackets as needing, cleaning appropriately, and monitoring, using that wean clean routine to figure out when disease is starting and whether or not things are working properly to prevent the antibiotic pressure on the calf biome. So with that, I apologize for kind of rushing through the end. I'm happy to take whatever questions there are.
New research is changing everything we thought we knew about choline's impact on the cow and her calf, and top scientists have a lot to say about it. They are presenting new research that supports choline as a required nutrient to optimize milk production, choline as a required nutrient to support a healthy transition, choline as a required nutrient to improve calf health and growth, and choline as a required nutrient to increase colostrum quantity. This new research is solidifying choline's role as a required nutrient for essentially every cow, regardless of health status, milk production level, or body condition score. Learn more about the science that is changing the game and the choline source that is making it happen. Reassure precision-release choline from Balchem. Visit balchem.com/scientistsay to learn more.
Dr. Ollivett, our first question comes in from Stephen, and he's asking, what is your goal for treatment success for a specific treatment protocol with only one treatment? How should we assess if our treatment protocol is effective?
Yep. It's a really good question, and take a couple of things into account. First, we want to make sure it's the first time the calf has been treated. Okay. And what my recommendation generally is that we go to a farm, or your vet goes to the farm, and I'm not sure if you're a veterinarian or producer or a nutritionist, but the vet gets to the farm, gets a list of calves that were just treated for the first time today or yesterday, scans those calves, figures out what their scores are. And then they're going to come back the following week. So come back 7 to 10 days later and rescan those same animals, rescan the ones that were treated for the first time, and again, see which ones have improved, what percentage has improved. And I would like to see 70 to 80% of those calves, so most of those calves, to have significant improvement in their lung scores. So in down to almost 0. So even if they're score 5, it's the first time they've been treated, and it's not chronic, meaning they're not small, they don't have thin top lines, they haven't been treated already a bunch of times. If it's a new case of disease in a young pre-weaned dairy calf, I expect 70 to 80% of those calves or more to have almost normal lung scores 7 to 10 days later, maybe up to 14 days.
All right, very well. Next question comes in from Duarte. How can you assess the cranial pars of the cranial lobe? Do you have the textbook pictures for the different ICS that I can use as guidance?
Yeah, I'm just gonna, can you guys see my screen again?
Yes. Mm-hmm.
So when we watch, what I want you to see when Austin scans this calf, she gets, let me just fast forward a little bit here. Just gonna put the alcohol on there. The key first off, the key is knowing your landmarks. Each rib space has a specific ultrasonographic landmark that tells you where you are. So you don't have to count spaces. And so when we're, for instance, I'm going to show you on this right-hand image here. Let me get up there. So there we go. So in this first image on the right-hand side where I see these vessels, I know I'm in the first rib space. Okay, it's a little hard to get me to stop. There we go. We have lung, it steps down and around these two vessels. Those are my landmarks that tell me I'm looking at the lung lobe in front of the heart, the right cranial lung lobe. And the way you're going to do that, you can see Austin's hand is on the side of the calf's chest. That right cranial lobe, the first rib space, is way up underneath that forelimb. So he's going to push his hand up underneath the triceps of that calf, so up underneath the elbow, in order to see that. But he's going to watch his landmarks as he goes from rib space to rib space to rib space to be able to see that spot. Calves, pre-weaning calves, they're pretty flexi-bendy. So it does take some effort to get up there. It is possible. An adult cow, we are not going to be able to get up to the first rib space from going behind the arm like that. We're going to actually have to come in front of the leg to see that rib space up front. So if I play this normal image again, I'll show you this is one rib space. This is probably the 6th rib space. This is the 5th rib space, 4th space, 3rd space, 2nd space, and 1st space. So just by looking at the landmarks I see on that screen, which I'm not telling you what they are right now, but we know where we are. If you go, I'm going to stop sharing here for a second. If you go to our Dairyland Initiative website, Google Dairyland Initiative website, calf health module, wean clean, I have a training video there that will go through all of the landmarks and provides videos and shows you how to do the actual technique. It does take some hand holding, and it's not something that I would expect somebody to be able to do without somebody that's already been trained working with you to do that, because it's really easy to see what you want to see on an ultrasound, and you don't want to misdiagnose a calf with bad pneumonia just because you don't realize you're actually looking at the liver. That has happened. Cats have died and been euthanized because the veterinarian saw a liver on ultrasound, not realizing the landmarks they were looking at were incorrect. So there is any of my materials online, or you can contact me or have your veterinarian contact me. I'm happy to help figure out how to get you trained.
All right, thank you. Dr. Ollivett, I see we've crossed the top of the hour. I want to be respectful of your time. Do you have a few more moments for some more questions?
I have plenty of time for questions, no rush.
All right, very well. Next question comes in from Jose. How many days after calving should I start with the ultrasound protocol?
Yeah, that's a great question. And part of I should have put up a slide for my wean clean protocol, but one component of that wean clean protocol is that we do what's called 12/7 scanning. Okay. 12/7 scanning means we take 12 calves at 7 days of age and scan them, 12 calves at 14 days of age, 12 calves at 21 days of age, 12 calves at 28 days, all the way through till weaning at one visit. And we see the proportion of calves that have pneumonia within that age group. Okay. Now, most calves, if they're indoor housed calves, you're going to see the development of pneumonia around that 14-day age group, or maybe at the latest, the 21-day age group. So 7 days will have 0. Then 14 days, maybe you'll get 20% or 25%. 21 days, you might have 60%. So I use that 7-day staggered kind of windows to develop a bit of a point prevalence to figure out when disease is happening. Now, if you feel like you're dealing with a post-weaning problem, you don't have to start at 7 days of age. You can say, well, I treat calves at 90 days of age. Well, back up a few weeks and pick your 12 calves that are 60 days old, 12 calves that are 70 days old, 12 calves that are 80 days old, where you can find where is that uptick, where is that onset of disease. It'll be different for every farm and every operation. Home-raised hutch calves outside, they can be very late in the pre-weaning period before you start to see disease, or you might not see any disease because they're outside, they don't have much stress if they're fed well and everything well taken care of. Sourced calves that are hutch-raised outside, they have similar levels of disease as indoor individually housed calves, right? So kind of next tier of lung disease, and then your indoor group house calves will have the highest level of disease and the earliest onset. So it depends a little bit on the operation where you'll find that onset of disease.
All right, next question is from Stan. In practice, would you recommend treating calves with LS2, or do you only treat LS3, pneumonia or higher? And then there's a follow-up question. Could treating animals before they reach lobular pneumonia help improve cure rate and prevent relapse from occurring?
Yeah, great question, Stan. So in practice, my standard recommendation is that if we're finding disease early, so we're routinely scanning calves that are at risk, so 14 to 21 days or 21 to 28, whatever the risk age is for that farm. The rule of thumb is going to be score 2, and a score 2 means they have at least 1 centimeter for the whole lung, 1 centimeter of consolidation. If they have 1 centimeter or more, they've never been treated before, and they're a young pre-weaned calf, our data says treat them. Our data also says treat them if they're clinical, even if they don't have lung disease. So don't forget, you still have to look at the calf. Yes, if you get a calf treated when they're a score 2, they are much less likely to become a score 3 calf. And that's the best treatment response we get is when we can get them treated at a score 2. So 1 centimeter or more.
All right.
I'll just add one thing, because if you start doing this, you got to realize if you're a veterinarian or if you're the producer, if you start finding disease sooner and you're using a more sensitive tool, you might panic when you see the list of calves that need to get treated after you start doing this. Don't panic. The disease level hasn't changed. You're just finding them now. All right. But they're going to perform better after you get them treated sooner. Okay. So be okay with that. Be prepared for that. And if you're a veterinarian or somebody that's going to be doing the scanning, make sure you warn the operator that this is going to happen so they don't get scared by saying, oh my gosh, we have twice as much disease. Okay. For every clinical calf out there, we can expect 2 to 4 subclinicals.
Okay. Marion would like to know if most of the veterinary clinics in North America, if they're using this protocol.
So I see the question here with the veterinary clinics of North America. It's a journal. It's a book out there. Yep. And yes, look in the 2016 Vet Clinics of North America, and I have a chapter in there that I wrote with Sebastian Buczynski that's got the technique, it's got the scoring system, it's got different ways to use it in that. And then I think there's another Vet Clinics 2020-ish maybe, where I did a review looking at housing types and its association with pneumonia. So not directly related to ultrasound, but gives you a little more information on housing prevention of pneumonia. But that 2016 Vet Clinics will have the technique in there.
All right, very well. I think I was telling you before, Dr. Ollivett, that I first heard about you while I was at the Western Dairy Management Conference and was speaking with a veterinarian and a dairy farmer, and they were very excited about using this tool to diagnose damaged lungs and then being able to predict or call animals before they got into the milking stream. Can you talk a little bit about that?
Yeah, so what we do know, if a calf has, our data would say that if a calf has ultrasonographic pneumonia, just 3 centimeters, that's not very much at all. In the first 2 months of life, she is going to make about 1,200 pounds less milk, 525 kilos, depending on where in the world you're coming from, first lactation milk. So it's a substantial amount of milk. It's interestingly very similar to the amount of milk lost when calves don't grow as well. So good work out of New York shown that if calves don't grow as well, they don't make as much milk first lactation either. I think the rule of thumb there is about 1,500 pounds for every pound of average daily gain that you will lose in that first lactation. So 1,500 pounds, 1,200 pounds, very similar. My guess is that the reason those numbers are so similar because calves that didn't grow very well in that New York study probably had subclinical pneumonia, right, driving that. So there is that long-term performance deficit that's going to happen from these calves that have pneumonia. Now, because some farms have 60 to 80% of the calves that will develop pneumonia. We can't get rid of all of these calves, right? But we can do what we can to manage it and control it and minimize it. The more severe disease they have, probably the bigger milk loss is going to happen. In the West Coast, folks that are using lung ultrasound regularly, they're using it more as a culling tool later on. So they can find animals that are performing subpar or have, been treated multiple times or still have chronic lungs, and they're going to cull them, at 4, 5, 6 months old versus keeping them all the way until they get pregnant, get bred. If they do keep them, we do know that these animals will get bred later, they will calve in later, and they will be more likely to have dystocia. So there are, and be less likely to make it to their first lactation. So there are these long-term impacts of having disease, ultrasonographic disease in the pre-weaning period. So you've got to decide for you and your operation kind of what question you want to answer. Do you want to use it as a culling tool? It can be used as a culling tool. And what I usually say is I don't say, well, get rid of every score 5 calf. Well, you might have a lot of score 5 calves and you might not want to get rid of all of them. But you may have a batch of calves that you need to make room. You're going to figure out who's got the worst lungs and get rid of them first. I think lung lesions trump genomics, right? If a calf is your highest genomic calf, but she's a score 5 and she's been treated 4 times already, she's not going to meet her genomic potential, right? It's there. In our adult cow study that we did, it does not appear as though the lung lesions stay with that animal until she calves in. We often say, oh, she had terrible lungs as a calf, and then she kind of peters out after she has her calf. I think that is some epigenetic engineering and printing that's going on. I think the switches have been flipped when she was a baby calf that determines her survivability later on in life. I don't think it's because she still has consolidation in her lung. I don't think that's why she fails when she calves in, because most of those cows, their lungs actually look fine, even though they had terrible pneumonia as a calf. Most of these young lungs will clear up, but whatever genes have been turned on or off during calfhood is what's causing that cow to not be a productive member of society later on in life.
All right. Well, Dr. Ollivett, that's going to do it. And on behalf of Balchem and Dr. Ollivett, thank you for joining us today.
We'd love to hear your comments or ideas for topics and guests, so please reach out via email at anh.marketing@balchem.com with any suggestions, and we'll work hard to add them to the schedule. Don't forget to leave a 5-star rating on your way out. You can request your Real Science Exchange t-shirt in just a few easy steps. Just like or subscribe to the Real Science Exchange and send us a screenshot along with your address and t-shirt size to anh.marketing@balchem.com. Balchem's Real Science Lecture Series of webinars takes place on the first Tuesday of every month, with the top research and nutrition topics that will impact your business. We also include small ruminant, monogastric, and companion animal-focused topics throughout the year. Visit balchem.com/realscience to see the upcoming topics and to register for future webinars. You can also access past webinars and search for the topics most important to you.